Picture this. You're sitting in your county health department office reviewing routine inspection reports when your phone rings, and an irate HOA president demands you immediately shut down an illegal medical facility operating out of someone's home. She's screaming about unauthorized surgeries, unlicensed medical equipment, and patients coming and going at all hours. What makes this complaint absolutely hilarious? The address she's reporting is your own house, where you operate a perfectly legal state-licensed outpatient surgical suite. And Susan Matthews just called the county health department director to demand an investigation of the county health department director's own medical practice. I'm Dr. Maria Gonzalez, and 3 months ago, I thought I was living the perfect balance between professional responsibility and personal convenience in Cedar Heights, one of those upscale planned communities outside Seattle, where every house looks like it belongs in a home improvement magazine, and the HOA dues cost more than most people's mortgage payments. My husband David and I had just moved here after 15 years of commuting from our old house to my job as King County Health Department Director, a position that makes me responsible for ensuring every medical facility, restaurant, and healthcare provider in our region meets state safety standards. David's a software engineer for Microsoft who works remotely, which gave us the flexibility to choose our location based on my medical practice needs rather than his office proximity. Our 16-year-old daughter, Isabella, was finally going to attend the highly rated Cedar Heights High School instead of the overcrowded urban district where we'd been living. And our 13-year-old son, Miguel, was excited about the community sports programs and the fact that he'd have his own room for the first time in his life. The house came with something incredibly rare in residential properties: a finished basement with separate entrance, proper ventilation, and electrical systems that could be converted into a state-licensed outpatient surgical suite. After years of fighting Seattle traffic to perform emergency procedures at county facilities, I could finally provide specialized surgical care to patients who needed immediate attention but couldn't wait for hospital scheduling or travel to distant medical centers. The surgical suite I built wasn't just legal, it was revolutionary. I'd spent 2 years working with state medical boards, county planning departments, and federal healthcare regulators to create the first residential surgical facility in Washington state that met every requirement for outpatient procedures. We had laminar airflow systems that exceeded hospital standards, surgical equipment that rivaled major medical centers, and infection control protocols that I'd personally designed based on 15 years of health department oversight. What I didn't realize was that my commitment to providing accessible health care was about to trigger the most medically ignorant harassment campaign in HOA history. Enter Susan Matthews, 52 years old, HOA president for 3 years, retired insurance claims adjuster, and the kind of person who thinks medical expertise comes from watching television, dramas, and Googling symptoms. She drives a silver Lexus RX that she claims proves her success, but she's never encountered a medical situation she couldn't misunderstand or a healthcare regulation she couldn't misinterpret. Susan has this obsession with residential purity, which basically means if you're not using your house exclusively for sleeping and entertaining, you're automatically violating community standards. When I began seeing patients in my licensed surgical suite, Susan appeared at my door within 48 hours, like some kind of medical practice detecting vigilante. Dr. Gonzalez, operating a medical facility in a residential neighborhood is completely inappropriate, she announced, clutching a folder full of printouts from medical licensing websites she clearly didn't understand. The Architectural Review Committee never approved commercial medical equipment installation. I'm holding my state surgical facility license and health department inspection certificates. Susan, this isn't a commercial facility. It's a licensed residential surgical suite with full state approval and county health department oversight. I literally oversee these regulations professionally. She waves her manila folder like evidence in a criminal trial. I don't care what licenses you think you have. Section 6.2 of our CC&Rs clearly prohibits commercial medical practice in residential areas. You're endangering our property values and violating zoning restrictions. The irony here is incredible. I'm the King County Health Department Director who's been regulating medical facilities for 15 years. I've personally inspected over 2,000 healthcare facilities across Washington state. I wrote the county guidelines for residential medical practice safety requirements. I teach continuing education courses to healthcare administrators about regulatory compliance. And this woman is trying to lecture me about medical facility regulations. Susan, I've been regulating healthcare facilities since before the current medical practice laws existed. My surgical suite exceeds all state requirements for outpatient procedures. The facility actually raises property values by providing specialized healthcare access to our community. She crosses her arms and gives me that condescending smile you see on people who think insurance claims experience makes them medical experts. Property values are exactly my concern. Medical facilities attract sick people, create parking problems, and generate medical waste that poses health hazards. I'm giving you 30 days to cease all medical operations voluntarily, or the HOA will be forced to take legal action. Legal action against the county health department director for operating a state-licensed medical facility. In full compliance with regulations I personally enforce. But here's where the story gets interesting. As Susan's marching back to her house in her designer heels, I'm noticing something that makes my professional health inspector instincts start tingling. Her garbage disposal is backing up into her yard. The standing water around her air conditioning unit suggests drainage problems. And that outdoor kitchen she's so proud of. Those food storage areas look like they haven't been cleaned according to basic sanitation standards. 3 days later, Susan makes good on her threat. A certified letter arrives demanding cessation of all illegal medical operations and threatening legal action if I don't restore residential integrity to the neighborhood within 48 hours. That's when David finds me in my home office, staring at Susan's house through the window with my health department inspection manual open on my desk. "Maria, what are you thinking?" David knows that look. It's the same expression I get when I discover healthcare violations that are going to require full regulatory investigation. "Honey, Susan Matthews has been harassing us for 3 months about a fully licensed medical facility. But I'm starting to wonder, when was the last time anyone actually inspected the sanitation standards in her house?" David sits down beside me, following my gaze across the street. "You mean professionally inspected? As in King County Health Department Director Maria Gonzalez inspected?" I'm pulling up county records on my laptop, cross-referencing permits and inspection histories. Susan's house was built in 2018, major kitchen renovation in 2020, pool and outdoor kitchen installation in 2022. But, David, look at this. The computer screen shows Susan's property record. Food service permits, none filed. Septic system inspections, overdue by 18 months. Pool chemical storage, no safety compliance documentation. And that outdoor kitchen. It's operating without any health department oversight while serving food to community events. "Maria, are you saying—" "I'm saying Susan Matthews might have more health violations than medical knowledge." The next morning, I decide to take a professional walk around the neighborhood. Not as Susan's annoying medical neighbor, but as County Health Department Director Gonzalez conducting routine community health assessments. What I discover makes my blood run cold. House after house shows signs of health violations that could endanger families. Improperly stored pool chemicals near food preparation areas. Septic systems with obvious backup problems. Outdoor cooking facilities operating without permits or proper food safety protocols. And Susan's house is the worst of all. Her outdoor kitchen has been preparing food for community events without any health department permits. The pool chemical storage violates hazardous material safety requirements. Her septic system is clearly malfunctioning and creating potential groundwater contamination. And that garbage disposal backup has created standing water that's attracting disease vectors. But Susan Matthews apparently doesn't understand the difference. "Dr. Gonzalez!" She's marching across her lawn toward me, waving her phone like a weapon. "I'm calling the health department. You're trespassing and harassing me." I'm standing on the public sidewalk with my county identification and inspection equipment. "Susan, I'm conducting routine health and safety inspections in response to community health concerns. It's part of my job." "Your job? Your job is shutting down that illegal medical facility you're running." That's when I realize Susan Matthews has no idea who she's been threatening for 3 months. "Susan, my job is King County Health Department Director. I regulate and inspect every healthcare facility, food service operation, and sanitation system in this area. including the violations on your property. For the first time since I've known her, Susan Matthews looks uncertain. What do you mean? I'm holding up my official county health department credentials and medical licensing documentation. I mean, I'm the person who enforces health and safety regulations. I'm the person who determines if facilities meet sanitation standards. I'm the person who can shut down operations for health violations. And Susan, your property has enough health code violations to require immediate remediation. The color drains from her face. That's impossible. We maintain the highest cleanliness standards. According to what health department inspection? She's fumbling with her phone, scrolling through emails and HOA documents. We don't need health department inspections for residential properties. Susan, show me one food service permit for your outdoor kitchen. Show me one hazardous material storage approval for your pool chemicals. Show me one septic system inspection that's actually current. She can't, because none of it exists. What Susan Matthews doesn't know, what none of the Cedar Heights homeowners know, is that they've all been operating their properties in violation of basic health and safety standards while thinking residential status exempts them from regulations that protect public health. And I'm about to teach them why those regulations exist. The complaint comes in on Thursday morning at 9:23 a.m. I'm sitting in my county health department office when my administrative assistant transfers a call from an urgent complainant demanding immediate health department action. King County Health Department, this is Director Gonzalez. Dr. Gonzalez, this is Susan Matthews from Cedar Heights. I need to report an illegal medical facility operating in violation of health codes in our residential neighborhood. I'm looking at my caller ID, which shows Susan's number, the same Susan Matthews who's been harassing me about my licensed surgical suite for 3 months. I see. Can you provide the address of this alleged violation? 1247 Cedar Heights Drive. They're performing unauthorized surgeries, using unlicensed medical equipment, and disposing of medical waste improperly. I demand immediate investigation and closure. 1247 Cedar Heights Drive. My address. Susan Matthews is calling the King County Health Department to report the King County Health Department Director's own medical facility. Ms. Matthews, I'll need to schedule an official inspection. Can you be available Friday morning to provide access and answer questions about your complaint? Absolutely. I'll be there with documentation proving these violations endanger our entire community. This is it. The most ironic health department investigation in Washington state history. Susan Matthews has officially requested that I investigate myself. What makes this situation even more professionally fascinating is that Susan's complaint triggers mandatory federal reporting requirements. Because she's alleging medical waste violations and unauthorized surgical procedures, I'm required by federal law to notify the Centers for Disease Control, the Washington State Department of Health, and the Federal Drug Administration about potential healthcare facility violations in our jurisdiction. The federal investigation protocol requires comprehensive documentation, multiple agency coordination, and detailed compliance verification that will take weeks to complete. Susan has inadvertently triggered the most thorough medical facility investigation in King County history, an investigation that will require me to document my own facility's compliance with over 200 federal healthcare regulations. But here's where Susan's medical ignorance creates an even bigger problem for her. Federal healthcare investigations don't stop at the reported facility. They expand to include environmental health assessments, community contamination screening, and neighborhood safety evaluations that examine every potential source of health hazards within a half-mile radius of the alleged violation. Susan's complaint about my medical facility has just triggered a federal investigation that will examine her property, her neighbors' properties, and every potential health hazard in our entire community. And as the county health department director coordinating this federal investigation, I'm about to discover health violations that make my perfectly compliant surgical suite look like a model of regulatory excellence. The federal pre-investigation consultation takes place Wednesday afternoon in my county health department conference room. Dr. Jennifer Walsh from the CDC, State Inspector Rebecca Chen from Washington Department of Health, and Federal Compliance Officer Michael Torres from the FDA review Susan's complaint with the detailed thoroughness that federal healthcare investigations require. Dr. Gonzalez, the complainant alleges multiple serious violations, including unauthorized surgical procedures, improper medical waste disposal, and unlicensed medical equipment operation, Dr. Walsh explains while reviewing Susan's submitted documentation. These allegations require comprehensive facility inspection, environmental contamination assessment, and community health impact evaluation. I'm sitting at the conference table reviewing my own facility's compliance documentation, licenses, permits, inspection certificates, and safety protocols that I've personally designed and implemented over 3 years of planning and construction. The facility in question operates under Washington State Outpatient Surgical License number 447291, current through December 2025, I explain, sliding the licensing documentation across the table. Environmental Compliance Certificate number 3847, Federal Medical Device Registrations, and Waste Disposal Contractor Agreements are all current and exceed state requirements. State Inspector Chen reviews the paperwork with the methodical attention that healthcare compliance requires. Dr. Gonzalez, these compliance documents are remarkably comprehensive. The environmental monitoring protocols exceed federal requirements, and the infection control procedures are being used as best practice examples by other Washington counties. Federal Compliance Officer Torres examines the surgical suite photographs and technical specifications. This facility demonstrates advanced safety features including laminar airflow systems, medical-grade HEPA filtration, automated instrument sterilization, and waste disposal protocols that surpass most hospital standards. The complainant appears to be unfamiliar with advanced medical facility requirements. But then Dr. Walsh raises the issue that changes everything about this investigation. Dr. Gonzalez, our environmental monitoring protocols require us to assess potential contamination sources within the investigation radius. Our preliminary satellite imaging shows several properties with environmental anomalies that require field investigation, including the complainant's property. The satellite images show heat signatures, water flow patterns, and waste disposal systems throughout our neighborhood. Susan's property shows multiple environmental red flags: standing water, improper waste disposal, chemical storage violations, and septic system malfunctions that pose immediate threats to community health. Dr. Gonzalez, federal protocol requires us to investigate all potential contamination sources before we can clear the reported facility. We'll need to conduct comprehensive environmental health assessments on 12 properties, including the complainant's residence. Susan Matthews' complaint about my medical facility has just triggered a federal environmental health investigation that will expose her own property's serious health violations to CDC, State Health Department, and FDA scrutiny. Friday morning arrives with classic Seattle overcast skies and 3 federal investigation vehicles in addition to my county health department team. Dr. Walsh, Inspector Chen, and Officer Torres coordinate with my environmental health officers, medical facility specialists, and documentation specialists for the most comprehensive healthcare facility inspection in county history. Susan is waiting in my driveway with her thick folder of printouts and that satisfied expression that says she thinks federal authorities are about to validate her medical ignorance and shut down a dangerous operation. Dr. Gonzalez, thank you for bringing federal investigators. This illegal medical facility has been endangering our community for months despite my repeated complaints. Dr. Walsh approaches with her federal credentials and CDC identification. Ms. Matthews, I'm Dr. Jennifer Walsh from the Centers for Disease Control. This is a federal healthcare facility investigation with environmental contamination assessment. Everything you say will be documented in our federal compliance report and may be subject to congressional oversight. Susan's satisfied expression falters slightly. Congressional oversight? I just want the illegal medical facility shut down. Ma'am, allegations of medical facility violations require comprehensive federal investigation, including environmental health assessment, community contamination screening, and facility operator background verification. Facility operator background verification? Yes, ma'am. We need to confirm the credentials and authority of the person operating the reported medical facility. Dr. Walsh turns to me with her official inspection clipboard. Dr. Gonzalez, please provide your medical credentials for federal verification. I hand her my Washington State medical license, my surgical board certifications, my county health department director identification, my federal DEA registration, and my healthcare facility operator permits. Dr. Walsh reviews the credentials while Susan watches with growing confusion. Dr. Maria Gonzalez, Washington State medical license number 23,847, current through 2026, board certification in general surgery, emergency medicine, and public health administration. King County Health Department Director since 2008. Federal Drug Enforcement Administration, registration current. Healthcare facility operator, permits exceed federal requirements. Susan's folder of printouts slips slightly in her hands. Ms. Matthews, you've filed a federal complaint alleging that Dr. Maria Gonzalez, the King County Health Department Director, is operating an illegal medical facility in violation of health codes that Dr. Maria Gonzalez personally enforces as the county's chief healthcare regulator. The printouts scatter across my driveway like evidence of the most bureaucratic comedy in federal investigation history. That's impossible. She can't regulate herself. Dr. Walsh exchanges glances with Inspector Chen and Officer Torres. Ma'am, county health department directors are specifically authorized to operate licensed medical facilities under federal healthcare regulations, provided they meet enhanced compliance standards and undergo additional federal oversight. But the medical waste, the surgical equipment, the patients coming and going. Ma'am, those are normal components of licensed medical facility operation. The question is whether they comply with federal healthcare standards. And that's how Susan Matthews' complaint triggered the most thorough, professional, and federally overseen health department inspection of my own medical facility in Washington State history. The federal investigation takes 2 full days. My surgical suite doesn't just meet federal healthcare standards. It exceeds them in every measurable category. The laminar airflow system surpasses hospital requirements for infection control. The surgical equipment includes advanced medical devices that most major medical centers don't possess. The waste disposal protocols I've implemented are being adopted by federal healthcare facilities as best practice examples. But more importantly, the investigation reveals that Susan's understanding of healthcare regulations is so fundamentally flawed that she's been reporting advanced safety features as violations, while completely missing actual health hazards in her own neighborhood. Dr. Walsh documents Susan's complaints point by point during the federal facility review. Ms. Matthews, this HEPA filtration system you've reported as excessive industrial equipment is required by federal law for surgical infection control and actually exceeds CDC recommendations. But the noise disrupts our peaceful neighborhood. Ma'am, it's preventing airborne bacterial contamination that could kill surgical patients. Federal regulations require continuous operation during surgical procedures. This autoclave system you've called hazardous steam equipment is mandated by FDA regulations for surgical instrument sterilization, but it releases steam that could be dangerous. Ma'am, it's eliminating pathogens that cause life-threatening post-surgical infections. This particular model exceeds federal sterilization standards. These oxygen tanks you've reported as dangerous compressed gas storage are emergency medical equipment required by federal patient safety regulations. But what if they explode and hurt someone? Ma'am, they're preventing patients from dying during surgical complications. The storage protocols exceed federal hazardous material safety requirements. Inspector Chen documents each of Susan's complaints alongside the actual federal regulations that not only permit but require every system she's reported as violations. Ms. Matthews, every item you've reported as a health violation is actually a federal safety requirement that protects patients and demonstrates advanced compliance with healthcare standards. But then Officer Torres makes the discovery that transforms this investigation from professional comedy into serious federal health enforcement action. Dr. Walsh, our environmental contamination monitoring is detecting significant health hazards from adjacent properties. We need to expand the investigation radius and conduct immediate community health assessments. The federal environmental monitoring equipment reveals contamination readings that pose immediate threats to community health: chemical contamination, biological hazards, and waste disposal violations that require emergency federal intervention. Dr. Gonzalez, federal protocol requires us to investigate all contamination sources affecting community health. We're detecting serious environmental violations that pose immediate risks to public safety. Susan's satisfied expression disappears entirely when federal investigators begin documenting environmental hazards on her property that violate multiple federal health and safety regulations. The federal environmental assessment reveals violations that shock even experienced health investigators. Susan's outdoor kitchen has been operating without federal food service permits while serving meals to community events that cross state lines, violating interstate commerce food safety regulations. Her pool chemical storage violates federal hazardous material safety requirements and poses chemical exposure risks that could trigger a federal emergency response. Most seriously, her malfunctioning septic system is creating groundwater contamination that affects multiple properties and violates federal clean water regulations, potentially requiring Environmental Protection Agency intervention and federal cleanup funding. But the federal investigation uncovers an even more disturbing pattern. Susan's property violations aren't isolated incidents. They are a part of systematic health hazard negligence that has been affecting Cedar Heights for over 2 years. The contaminated groundwater has been slowly spreading through the neighborhood's water table, affecting drinking water quality for 12 families who rely on private wells. Dr. Walsh's environmental team discovers that Susan's septic system failure began in January 2022, meaning she's been knowingly allowing raw sewage contamination to spread through the community water supply for 24 months while complaining about my perfectly compliant medical facility. The environmental contamination timeline shows peak contamination levels, coinciding exactly with periods when Susan was filing the most aggressive complaints about my surgical suite. Dr. Gonzalez, the contamination data suggests the complainant was using harassment tactics to distract attention from serious environmental violations that pose immediate threats to community health, Dr. Walsh explains while reviewing the contamination timeline. This pattern of behavior may constitute criminal negligence under federal environmental protection statutes. The federal criminal investigation expands to include willful environmental endangerment charges. Susan's documented awareness of her septic system problems, combined with her systematic efforts to deflect health department attention toward my legal medical facility, constitutes criminal negligence that has endangered multiple families' health for 2 years. Federal prosecutors examined Susan's insurance correspondence, maintenance records, and HOA communications, discovering evidence that she knew about the septic system failure but chose to ignore remediation while directing community attention toward fabricated concerns about my medical facility. The evidence includes insurance company letters warning Susan about septic system problems that she ignored, contractor estimates for septic repair that she refused, and HOA emails where she explicitly stated her intention to focus community attention on the illegal medical facility rather than waste time on minor property maintenance issues. Ms. Matthews, your property shows multiple serious federal health violations that pose immediate risks to community safety and may require federal enforcement action. This is harassment. You're retaliating because I complained about the illegal medical facility. Dr. Walsh reviews her federal inspection clipboard with the authority that CDC investigations carry. Ma'am, these violations were discovered during mandatory environmental monitoring required by federal healthcare investigation protocols. They pose immediate risks to public health and trigger federal reporting requirements. I want to speak to someone in charge. Ma'am, I am the federal authority in charge of this investigation. I report directly to the Centers for Disease Control in Atlanta. Officer Torres steps forward with federal environmental enforcement documentation. Ms. Matthews, we also need to inform you that willful concealment of environmental contamination while filing false complaints against licensed healthcare facilities may constitute federal criminal negligence under environmental protection statutes. Susan's satisfied expression disappears entirely as she realizes the federal investigation has revealed not only her property violations, but potential criminal liability for environmental endangerment and harassment of healthcare providers. The federal cease and desist order requires Susan to immediately stop all food service operations until federal permits are obtained, properly dispose of hazardous chemicals according to EPA protocols, repair her septic system to federal clean water standards, and remediate the environmental contamination under federal oversight. Cost estimate: $127,000. Additionally, the Environmental Protection Agency begins criminal investigation procedures for willful environmental contamination that endangered community water supplies while attempting to harass licensed healthcare providers as a distraction tactic. Dr. Gonzalez, federal protocol requires us to notify the Environmental Protection Agency about willful environmental contamination, the Department of Justice about potential civil rights violations regarding healthcare access interference, and the Department of Health and Human Services about harassment of federally protected medical facilities. Susan Matthews faces potential federal criminal charges for environmental endangerment, civil rights violations for healthcare access interference, and criminal harassment of licensed medical facilities under federal healthcare protection statutes. The combined federal penalties could result in $500,000 in fines and up to 5 years in federal prison. But the federal investigation also reveals systematic health violations throughout Cedar Heights that require comprehensive community health intervention beyond anything our county has previously undertaken. But the story doesn't end with Susan's federal health violations and $127,000 in remediation costs. It continues with community health transformation, medical practice protection, and federal healthcare policy advancement that demonstrates how professional medical expertise can overcome ignorance while creating lasting improvements in public health and healthcare accessibility. The federal investigation results trigger the largest community health intervention in King County history. The CDC's comprehensive assessment reveals that Cedar Heights isn't an isolated case. It's representative of a nationwide problem where affluent suburban communities operate with dangerous health violations while opposing legitimate healthcare facilities through HOA harassment and zoning manipulation. Dr. Walsh's federal report identifies systematic patterns that require congressional attention and federal policy development. Dr. Gonzalez, our investigation has uncovered evidence of coordinated healthcare access restriction that may violate federal civil rights laws and Americans with Disabilities Act provisions. This case is being forwarded to the Department of Justice Civil Rights Division for potential federal prosecution. The federal civil rights investigation expands beyond Susan's individual harassment to examine whether Cedar Heights HOA policies systematically discriminate against residents who require accessible healthcare services. Federal investigators discover HOA bylaws that effectively prohibit medical equipment, ban healthcare workers, restrict ambulance access, and create barriers that violate federal disability protection laws. The Department of Justice Civil Rights Division assigned Special Prosecutor Amanda Richardson to investigate systematic healthcare access discrimination in suburban HOA communities. The investigation expands to examine 12 similar communities across Washington state, where licensed healthcare providers have faced HOA harassment that may violate federal civil rights protections. Dr. Gonzalez, our preliminary investigation suggests a pattern of healthcare access discrimination that affects protected classes under federal law, disability law. Special Prosecutor Richardson explains during our federal coordination meeting, "We're documenting cases where HOA harassment has forced disabled residents to relocate because they couldn't access essential medical care in their own communities." The federal civil rights investigation discovers that Susan's harassment tactics aren't original. They're part of a coordinated strategy developed by HOA management companies that specifically target healthcare providers to avoid potential liability issues. The strategy involves systematic complaints, aesthetic objections, and zoning challenges designed to force medical professionals to relocate rather than serve communities that need accessible healthcare. Federal investigators find evidence that Suburban Management Solutions, the company that manages Cedar Heights HOA, has been training HOA board members across Washington state to use harassment tactics against healthcare providers as a liability reduction strategy. The training materials explicitly instruct HOA presidents to file multiple complaints about commercial activity, aesthetic violations, and safety concerns to create legal pressure that forces healthcare providers to cease residential medical practice. This isn't isolated healthcare harassment. Special Prosecutor Richardson explains, this is systematic civil rights violation designed to restrict healthcare access for disabled and elderly residents who benefit from residential medical facilities. The federal investigation reveals that Suburban Management Solutions has been implementing these discriminatory tactics in 47 HOA communities across 3 states, affecting over 180 licensed healthcare providers and denying medical access to thousands of families who depend on residential healthcare services. Susan's complaint about my surgical suite inadvertently triggers federal civil rights enforcement that results in comprehensive HOA policy reform, federal monitoring of residential healthcare access, and precedent-setting legal decisions that protect healthcare providers nationwide. The community health education program that emerges from this federal investigation becomes a national model for suburban health policy integration. David helps me develop digital platforms that allow residents to access health department resources, understand medical facility regulations, and report legitimate health concerns while protecting healthcare providers from ignorant harassment. Our digital health education platform attracts national attention from the Department of Health and Human Services, which funds expansion to serve as a model for other communities dealing with healthcare access discrimination. The platform provides residents with verified medical information, helps them distinguish between legitimate health concerns and discriminatory harassment, and connects them with appropriate authorities when actual health violations occur. Isabella and Miguel become youth ambassadors for community health education, developing educational programs that teach other teenagers about healthcare access rights, medical facility safety protocols, and public health protection. Their presentations reach over 1,200 students across Washington state, creating a generation of health-literate young people who understand the difference between legitimate health concerns and medical ignorance. The federal investigation also reveals the profound community impact of accessible healthcare services that HOA harassment threatens to eliminate. Mrs. Chen's diabetes management program, which relies on immediate access to my surgical suite for emergency procedures, has kept her out of expensive emergency room visits and prevented 3 potential diabetic emergencies that could have been life-threatening. The economic impact analysis shows that families using residential medical facilities save an average of $8,400 annually in healthcare costs, while receiving superior medical care compared to patients relying exclusively on hospital emergency departments and distant medical centers. The Rodriguez family's daughter, who has a rare blood clotting disorder, receives monthly procedures in my surgical suite that previously required 6-hour round trips to Seattle medical centers. The accessible care has not only improved her health outcomes, but prevented the family from facing financial hardship due to travel costs and lost work time. Dr. Walsh's federal report documents how residential medical facilities like my surgical suite reduce healthcare system burden while improving patient outcomes and reducing costs for families and insurance companies. The data shows 34% reduction in emergency room utilization, 67% improvement in preventive care compliance, and 89% patient satisfaction improvement compared to traditional healthcare delivery models. Mr. Thompson's elderly mother recovers from hip replacement surgery using specialized wound care services I provide in the surgical suite. Without accessible medical care, her recovery would have required expensive nursing home placement that the family couldn't afford. The specialized residential care allows her to recover at home while receiving professional medical attention that ensures optimal healing and prevents complications. But the most significant community health impact involves pediatric emergency care that saves children's lives when hospital transport isn't feasible during Washington's severe weather emergencies. During the ice storm of February 2024, when emergency vehicles couldn't navigate Cedar Heights' steep roads, I perform emergency appendectomy on 12-year-old Tyler Kim in my surgical suite while coordinating with Seattle Children's Hospital via telemedicine. The surgery prevents potentially fatal peritonitis, and Tyler recovers completely without requiring dangerous transport during hazardous weather conditions. The federal case study that emerges from Tyler's emergency surgery influences national healthcare policy regarding residential medical facility authorization during disaster scenarios. Congress passes the Rural and Suburban Healthcare Access Protection Act, which includes provisions specifically protecting residential medical facilities from local government and HOA interference when they provide emergency care during natural disasters. The congressional testimony I provide about Tyler's emergency surgery demonstrates how residential medical facilities serve as critical healthcare infrastructure during emergencies when traditional medical facilities become inaccessible. Representative Sarah Martinez from Washington State sponsors the legislation, citing our case as evidence that residential medical facilities deserve federal protection equivalent to other essential healthcare infrastructure. Susan's complaint about my medical facility ultimately results in federal legislation that protects healthcare access for thousands of families nationwide while establishing legal precedents that prevent similar harassment of medical professionals. The Washington State Medical Association invites me to serve on the Healthcare Access Protection Committee, where I help develop statewide policies that balance community safety with healthcare accessibility. The committee's work influences medical facility licensing procedures in 12 states, creating pathways for qualified physicians to provide residential healthcare services while maintaining rigorous safety standards. Our committee develops comprehensive guidelines that help physicians navigate community integration challenges while ensuring patient safety and regulatory compliance. The guidelines address zoning requirements, insurance considerations, waste disposal protocols, and community education strategies that help healthcare providers avoid the harassment I experienced while maintaining professional medical practice standards. The King County Health Department expands its residential medical facility oversight program based on lessons learned from our case. We develop comprehensive guidelines that help physicians navigate licensing requirements, community integration, and HOA relations while ensuring patient safety and regulatory compliance. Our program now oversees 47 residential medical facilities throughout King County, providing specialized healthcare services that reduce emergency room overcrowding while maintaining safety standards that exceed hospital requirements. The economic impact analysis shows $2.3 million in annual healthcare cost savings while improving health outcomes for over 800 families. The Cedar Heights community transformation extends far beyond health department compliance into comprehensive wellness advocacy that makes our neighborhood a destination for families, prioritizing healthcare access and community safety. Property values increase 18%, not just because of verified health department compliance, but because buyers specifically seek communities with accessible healthcare services, federal civil rights protection, and transparent governance that prioritizes resident safety over aesthetic preferences. Insurance companies offer premium discounts for Cedar Heights residents because our community health data demonstrates reduced emergency room utilization, better preventive care access, and superior health outcomes compared to similar suburban communities without accessible healthcare services. The community develops innovative health promotion programs that combine my medical expertise with resident participation in wellness education, disease prevention, and health emergency preparedness that serves as a model for other suburban communities nationwide. We established the Cedar Heights Community Health Council, where residents work with healthcare professionals to address health concerns through education and prevention rather than complaints and harassment. The council's monthly meetings provide health education, preventive care resources, and community health advocacy that empowers residents to make informed decisions about their family's healthcare needs. The council's work influences health policy development at county and state levels, particularly regarding rural and suburban healthcare access during emergencies and natural disasters. Our emergency preparedness protocols, which integrate residential medical facilities with county emergency response systems, are adopted by 6 other Washington counties and 3 additional states. Susan Matthews faces not only $127,000 in federal health violation remediation costs, but potential federal civil rights charges for systematically interfering with healthcare access in violation of Americans with Disabilities Act provisions. The Department of Justice Civil Rights Division opens a formal investigation into whether her HOA harassment constitutes discrimination against residents who require accessible medical care. The federal civil rights investigation expands to examine HOA policies nationwide that may violate healthcare access rights, leading to congressional hearings and federal enforcement actions that protect residential medical facilities from local government and HOA interference. Susan's insurance company denies coverage for her environmental remediation costs because the violations result from willful neglect of basic health and safety standards rather than accidental contamination. Her property value decreases 23% due to environmental contamination disclosure requirements and federal monitoring restrictions that will remain in effect for 5 years. But more importantly, Susan undergoes court-mandated health education that helps her understand the difference between legitimate health concerns and medical ignorance that endangers community safety and violates federal civil rights protections. 6 months after the federal investigation, Susan approaches me during a community health council meeting attended by 67 families who have benefited from accessible health care services and federal civil rights protection. Dr. Gonzalez, I owe you and this community a profound apology. I didn't understand that medical facilities require professional expertise and federal oversight, or that my complaints violated civil rights laws that protect healthcare access. Your surgical suite has been a tremendous asset to our community, and my ignorance nearly cost families essential medical care they depend on. She continues, the health education program helped me understand that healthcare professionals like you exist to protect community health, not threaten it. I've learned to distinguish between legitimate health concerns and ignorant complaints that waste federal resources while violating civil rights protections. The federal recognition that follows our case includes congressional testimony about residential health care, access protection, CDC commendation for community health innovation, and Department of Justice appreciation for civil rights enforcement cooperation that establishes national precedents protecting healthcare providers from local harassment. Today, Cedar Heights has 7 residential medical facilities operating under federal civil rights protection and enhanced health department oversight. Our community provides specialized health care services that serve over 400 families annually, while maintaining safety standards that exceed federal requirements and serve as models for other communities nationwide. I continue working as King County Health Department Director, where my role has expanded to include federal healthcare access advocacy, civil rights enforcement coordination, and national healthcare policy development that protects medical professionals while ensuring community safety. The surgical suite that Susan tried to eliminate now serves as a federal case study demonstrating how residential medical facilities can enhance community health while maintaining rigorous safety standards and federal regulatory compliance. Congressional representatives visit our community annually to observe healthcare access protection in practice and understand how federal civil rights enforcement can improve community health outcomes while protecting medical professionals from ignorant harassment. The federal policy changes that result from our case influence healthcare access protection in all 50 states, establishing legal precedents that prevent local governments and HOAs from interfering with legitimate medical practice while maintaining appropriate safety, oversight, and community integration. Sometimes the most satisfying response to medical ignorance isn't individual revenge. It's federal civil rights enforcement that protects healthcare access for thousands of families while establishing legal precedents that prevent similar harassment nationwide. The systematic change we've created extends far beyond Cedar Heights to influence federal healthcare policy, civil rights enforcement, and community health advocacy throughout the United States. Susan's attempt to shut down my medical facility ultimately resulted in federal legislation, civil rights protection, and healthcare access preservation that benefits communities nationwide. Your healthcare harassment or medical facility discrimination story contributes to a larger movement for healthcare access protection and civil rights enforcement that benefits families throughout the country. Every story of medical ignorance, healthcare access restriction, or professional harassment helps build awareness that protects other healthcare providers while ensuring community safety through proper regulation rather than ignorant complaints. Share your experiences in the comments below, and let's create a comprehensive database of knowledge that helps communities fight back against medical discrimination with professional expertise, federal civil rights protection, and regulatory compliance that creates lasting positive change. Your story could prevent another healthcare provider from facing similar harassment while encouraging community health improvement through professional medical expertise. Remember that licensed medical professionals exist to protect community health and provide accessible healthcare services that enhance rather than threaten community safety. Medical ignorance and aesthetic complaints should never prevent qualified physicians from serving their communities safely and legally under proper regulatory oversight and federal civil rights protection. Thanks for watching HOA Revenge Stories, where we prove that every HOA Karen eventually meets their match.